You'll want to do several things the day before your surgery. These may include buying and using eye drops if they've been prescribed to you, completing a list of all medications that you're taking, learning to clean your eyelids, and following a schedule of when you can and can't eat before surgery. Instructions for patients who will need eye drops. After considering your overall condition and eye health, your doctor has determined whether it's better for you to have cataract surgery with or without eye drops. And he or she will let you know if you need to pick up any of these medications. Make sure you pick up your eye drops before surgery. If prescribed, most individuals will have at least 2 eye drop medications. One eye drop is an antibiotic. This is used to help prevent infection. The other is a steroid called prednisolone, used to help reduce inflammation. You need to shake this drop for 30 seconds before using each time. Start these eye drops the day before surgery and use them 4 times a day or about every 5 to 6 hours during waking hours, including on the day of surgery. Some of you may receive another drop called diclofenac or ketorolac, especially if you have diabetes or certain types of retinal problems. This drop bottle has a gray cap. Start this also 1 day before surgery, 4 times a day. Some patients might be asked to use a dilating drop called atropine. If you are prescribed this drop, please start it 3 days before surgery and continue to use it as directed until the morning of surgery. This is the only drop that should not be continued after surgery. It will keep your eye dilated for up to 2 weeks following surgery, but it may help your surgeon have an easier time removing your cataract in certain situations. Instructions on how to use eye drops. Wash your hands. Shake the bottle if it's prednisolone. Tilt your head back. Put only 1 drop in the eye. Close your eyes and plug the part of the eye nearest the nose. Try not to touch the eye with the tip of the dropper, as this can cause trauma to the eye and also contaminate the bottle.
Medication list. On the day of your surgery, please bring a list of all the medications you are taking, including both prescription and non-prescription drugs. If you use medicines or dietary supplements that you bought on your own, include these on your list of medications as well. Even if you've stopped taking medications within the last month, record these medications on the list and indicate the last time you used them. A link to this handout is located at the bottom of this page. It's important to minimize the risk of eye infection after cataract surgery. Bacteria normally live on the eyelid and eyelashes, and sometimes these bacteria can cause an infection after surgery. Cleaning your eyelids before surgery can reduce this bacteria. Start cleaning your eyelids the day before your surgery. Do this to both eyes 3 times before surgery, once in the morning the day before surgery, once before bedtime, and once the morning of your surgery. Do not continue eyelid cleaning right after surgery because it's not safe to put pressure on your eyes for about a week. Here's how you clean your eyelids. Take a soft baby washcloth and dip it into warm water. Wring it out and place the warm washcloth on your closed eyelids for 2 full minutes. When the cloth cools down, soak the cloth in warm water again so that your eyelids are exposed to warmth for a total of 2 minutes. Next, wrap your washcloth around 1 finger and gently press your finger against the rim of your upper eyelid and then the lower eyelid. Add 4 drops of baby shampoo to 1 cup of warm water and mix. Again, wrap the washcloth around your finger and dip the cloth into this solution. Then use this washcloth to gently clean your upper and lower eyelids. Use the washcloth to brush through your eyelashes. Your eyes may be open or closed during this procedure as long as you take care not to touch the eye itself. It's important not to rub too hard or cause irritation to the eyelid. Finally, rinse your face with warm water and dry with a towel.
Fasting before surgery. You can eat regular food like solids, nutritional shakes, soups, gum or candies, and cough drops or mints up to 8 hours before your scheduled arrival time. You can drink clear liquids such as water, clear apple juice, plain tea, or black coffee without milk or milk substitute, up to 2 hours before your scheduled arrival time. Do not drink orange juice or other juices because these may not be clear. If you have any medication on the day of surgery, take it with a sip of water. We understand that mistakes happen. Just let us know as soon as possible if you are not able to follow these guidelines. If you have diabetes, don't take your oral diabetic medication or short-acting insulin the morning of your surgery. If you take long-acting insulin, use only half your normal morning dose just prior to leaving for surgery. Bring your insulin with you to the surgery center. We'll let you know if you should use it right after surgery.